I had been diagnosed with Lyme disease and a whole myriad of other things, but it manifested in congestive heart failure in December of 2008. And it's been with me ever since. I had an initial ejection fraction of 30, which is very low.
What do they consider normal?
Normal is 55 to 60.
And what we're talking about ejection fraction, that's the heart being able to pump the blood.
The blood and not have a lot of blood regurgitation into the
Right. So the
chambers.
heart's able to pump the majority of the blood out to the brain and the body.
Right.
So yours was not pumping enough at the time.
Not pumping enough, which also made breathing very difficult and activities very difficult. Just everyday life kind of difficult. So I have always been an active person, and I could still function, but the Energizer Bunny had to slow the pace quite a bit.
Mm-hmm.
I did have a cardiac ablation in 2018, and it reduced my extra heartbeats, or PVCs, about 5 or 6% from 25 to 20, but they slowly came back.
Your PVCs they're not healthy, they're not comfortable, you could feel it.
Right, and they zap energy.
And they were definitely monitored by your heart monitor.
Yes,
right?
I've had numerous Holter monitors, 3-day, 5-day, 28-day, and they all showed the same thing. The one in May of 2022, and after I completed your second protocol, showed that my PVC burden had dropped from 25% to 2.17% of my heart.
That's
phenomenal.
How amazing is that?
And
wow.
Yeah, and my ejection fraction, thank you,
You're welcome,
rose to 55.
55. That is phenomenal.
Yes, it is.
And
yes.
what did this physician say?
Mostly it was the look on his face. He was extremely happy, all smiles.
Was it surprised? Like, wow, how is this possible? I'm just happy for you?
A little bit. And they wanted to confirm it, so they put a 5-day monitor on my chest. And
5-day monitor confirmed everything.
Everything.
2.17 and the 55% ejection fraction.
Yeah.
Pretty amazing.
Very amazing.
And so now congratulations. I'm very happy for you.
I'm very happy.
Yeah. So then when we find the root cause of the condition, and that's what we've been after here,
Yep.
get rid of the root cause of the diseased heart and get the body to rejuvenate itself. And if we can say even the stem cells, they helped you some, but they didn't really bring you to this point.
I believe that they were additive, but I don't think they were the primary.
The primary. What do you think was the primary?
You.
Thank you. Thank you.
Well, I've been on both sides of medicine, and I totally understand what Dr. Herman is doing here in the clinic, and I am a firm believer in what he does, and I'm going to come back until I am so squeaky clean, he won't know what to do with me.
Stay tuned. We're going to get to the next video, and I'll describe what I found, and I'll give you a little bit of insight into the type of exam that I'm doing, and it's time for you to get better too. You have a great opportunity, got a great chance, and we're here to help you. Stay tuned. Isn't that just incredible? No more skipped beats, no more extra contractions of the ventricles of our heart, and a perfectly normal ejection fraction. Amazing. My name is Dr. Lonnie Herman, and in this video, I'm going to share with you how I helped Miss Sue achieve normal heart function after she had been diagnosed with congestive heart failure since 2008. At the end of this video, you're going to hear her speak in full about her journey throughout the many years since 2008 with her congestive heart failure symptoms, with her diagnosis. She went through stem cell treatments that brought up the function a bit. Not perfect. She has medications that she's been on, diuretic and blood pressure meds, that kept her alive, kept the heart functioning, but never brought her back to normal function until just now with my work. Again, my name is Dr. Lonnie Herman, and in this video I'm going to share with you how I helped her achieve that normal function with her heart, erasing the years of congestive heart failure within just a few visits in my treatment here. And also I'm going to make you a free offer in this video. And again, I'm going to share with you in pretty specific detail how I helped her achieve that, okay? So let's take a break and I'll be back in just a moment. You can go on my website and download my book for free, but how you can reclaim your health, how you can use quantum energized medicine protocols to actually reverse seemingly incurable chronic illnesses or chronic diseases. Download my book, read it. It's very simple, 40 pages. Maybe it'll take you about an hour. And inside that book, there are a lot of big pictures. It's big font. There's not too much reading, literally maybe an hour. There are 3 links inside my book that you should click on and read more about my work, about my unique quantum food sensitivity assessment examination that we perform on every patient, about my quantum dental assessment, as well as on the very last page, I highly recommend, because you're going to want to know how I do what I do for people. I give a brief insight to that on my journey as a physician to become your physician who gives you the answers, as well as into my method of how I'm doing what I'm doing and the science behind it. On the very last page, click that link. It brings you to a private page on my website. And on this page, you can watch a 42-minute video in where I'm presenting my journey as a physician, the type of labs I used to run, my education, my background, as well as my method, okay? All right, so let's understand something about the heart function. Number one, there are toxins that get into the body, get into the brain, get into the heart, that get into the kidneys, that get into the liver, your lymphatic system, your adrenal gland, your bone marrow. When these toxins get into any different tissue of your body, they cause those tissues, the organs, the glands, the bone, the lymph to malfunction, and we see symptoms develop in the body. Another topic we've got to understand is infections get into the body. There's mold infections, there's bacteria, there's fungal infections, viral infections, parasitic infections that get into the tissues of the body, including they can get into the heart. I'll show you a perfect example of this in just a moment. These infections get into the tissues of the body, including the heart muscle, and can cause the heart to malfunction. Let's take a look at this image right here. I'm going to put up an image that you can even find if you do a search on the well-known search engine Google and look up mitral valve vegetations. And in this image I'm going to show you here, under mitral valve vegetations on Google search, you will see growths that occurred on the mitral valve. And these growths are fungal and mold infections. We can even see bacteria go to the heart as well. You know, the common term of strep throat, streptococcus bacteria that gets into somebody's throat and causes throat swelling or tonsil swelling. Well, the strep bacteria isn't programmed with a GPS tracking device that makes it only go to the throat area. That infection can easily get to the heart as well. And the same for any other infection, whether it's a staph bacteria or whether it's an influenza virus or an Epstein-Barr virus, or whether it's the new COVID that's going on in the world since the past 2+ years. Any of these types of infections can get into the heart muscle as well. And I'll tell you what I found with Miss Sue as well in just a few minutes. So we've got to understand toxins get into the body, infections get into the body, including the heart, as well as we can have what's called activated mast cells that occur in the body. These mast cells are triggered to become activated mast cells and release inflammatory substances into the heart muscle, into any muscle, the bone, the lymph, the kidneys, the liver, any part into your brain. These activated mast cells now cause terror. They cause horrible symptoms. They cause stress in the organ. And they can also cause hypertrophy of the heart. They can cause the heart to malfunction. We've also got to understand that inflammatory proteins can exist in the body, like, for example, one we'll talk about called MMP9. This protein MMP9 is found to be created by your own body, and this protein can now cause further inflammation. Why would your body create this inflammatory protein? It's an actual result of other causes of inflammation in your body. Causes like, for example, infections and toxins that get into your body. We're going to talk about something else in just a moment, is food stresses on the body, whether it's, as people called, gluten sensitivity or dairy sensitivity. There's many other reasons. It's not just gluten and dairy. We can have stresses to certain spices that we consume. We can have stresses to certain vegetables and nightshades that we consume. We can have stresses to certain oils that we're consuming, even olive oil that's supposed to be very healthy for the heart, according to the American Heart Association. Just know that certain foods can stress you as well. And I did a very thorough, very detailed, and very in-depth food type of a testing analysis that I perform here in my clinic. I did this with Sue as well. And in a very unique way, we're able to actually go with the foods and find these different stresses connected from the tongue to a part of your brain known as the homunculus. The homunculus, you may not have heard that before. I'm not here to turn you into a neurologist or a cardiologist or a physician, but the homunculus of the brain, it gives us an understanding of how parts of the brain, like the cortex, the outer part of the brain just below the skull, the cortex controls parts of the body or influences the function on parts of the body, even your heart. You know, scientists have actually cut off the cap of the skull and removed the cap of the skull. They stick a pin in a part of the brain, and people never felt the pin entering the brain. They felt it in the part of the body that's represented in that part of the brain. So, for example, the tongue is in the part of the brain. The hand is in the cortex, in the homunculus part of the brain. The feet, the heart, the stomach, every part of your body is mapped in the cortex of the brain. So I did a very detailed analysis with consideration about the homunculus. I'll show you an actual image. Right now, there's a picture of, you can find online, of how body parts are represented in the cortex of the brain, and this what we call in neurology as the homunculus of the brain. Well, when the hands appear really big in this model, it's because there's such a wide area of the cortex of our brain that represents the hand function. The same for the tongue. So I found a very unique way of going from the tongue with my type of exam, the tongue to the brain, and helping to figure out things wrong with, for example, the heart and the mitral valve and the tricuspid valve. And I won't go too deep into that analysis, but there is a way that we can actually find if certain foods are stressing your heart muscle and directly affecting the heart muscle. And those foods are not foods that you have to stay away from for the rest of your life. It's because the foods are connected to a stress in the heart. For example, where there's an infection in the heart. So let's say the influenza virus got into your heart and you don't have a cold, you don't have a fever or chills now, but you do have a heart malfunction. The influenza virus could be in the AV node, the controller of the electrical impulse that's going through the heart. That node can have the influenza virus affecting it. And you don't have to feel like you have the flu, as people call it. And that influenza virus can change the heart function, can change the heartbeat function, can cause extra ventricular contractions, can cause an ejection fraction, decrease in ejection fraction of the amount of blood going to the brain and the body. So we can find what certain foods, like for example wheat, may stress the body because the influenza virus is on the AV node, and then we get the influenza off the AV node, and then the heart function can begin to return to normal, as well as the sensitivity, the stress to the wheat starts to disappear. You heard that right. It's not a food sensitivity forever. It's a food sensitivity until we get rid of the infection that is connected to that food stress. You can learn more about that on my food page on my website about my food type of testing, my quantum food diagnostic examination skills that I've developed here in my clinic. So let's understand, again, there's infections, there's toxins, activated mast cells, there's inflammatory proteins that affect the heart function, there are stresses to foods that affect the heart function, there's also traumas. Somebody might have had a concussion, maybe somebody broke a bone earlier in life. That can also cause what I'll call a ripple effect to the heart. It's like dropping a pebble in water. You drop a pebble, the water ripples. Well, imagine a trauma to your body. You had a head concussion, and it didn't cause a traumatic brain injury, but it did cause a rippling, a stress from that head trauma down to the heart, and it's offsetting the heart function. I have a way of figuring that out as well if that caused it, and that's part of something I did with Sue in her care, in her treatment of what we did to get her heart back to normal. And the next is emotions. Emotions play a role in heart function. And there are certain things, I won't go into detail, it's her own personal story, but there are certain things in Sue's past where I found that those emotions that were still playing a role today from over 20 years ago playing a role today, well, up until we fixed her, I'll say, but playing a role in the present year in degrading her heart function. Sometimes people feel guilty about certain ways that they handled or didn't handle things with their family members who passed already. Sometimes somebody might have been molested as a child, and it's causing this energy stress in their body that's offsetting decades after the molestation occurred. That memory that's deeply embedded in the brain can now cause a stress on the heart. And something that we know about the human, you might have heard the term microbiome, where we have bacteria and germs in the body that make up the body. We also have what's called a virome. There are viruses as part of our DNA. Now, if you go to my page on my website here, it's called my emotional impact, my deep emotional examination strategy that I've developed to find these different emotional blocks in somebody's body, these emotional burdens that people have been carrying for weeks, months, or even decades. These emotional burdens can actually trigger dormant viruses that are in the brain, in the heart, in the liver, any part of the body that's causing the body to malfunction. Okay, so that's a long list. One more time: infections, toxins, activated mast cells, inflammatory proteins. We have traumas. We have emotional traumas, emotional scars that are playing a role in causing the burden on the heart that cause the congestive heart failure. All right. So with Miss Sue, we found first in her first visit, April of 2021. November of 2021 was her second visit, March of 22, and June of 22. Before the June visit, she was already improved. In just three exams, 3 treatments, 3 visits in my clinic, in a year's period of time, her heart is back to normal. 3 visits. I'll tell you the findings here. I discovered that she had the Epstein-Barr virus, known as mononucleosis. You might have heard that, the Epstein-Barr virus affecting her heart. She had multiple different candida fungal infections affecting her heart. She had the candida affecting the brain. Understand the brain does help the heart rate. You know, when somebody gets scared, like there was going to be a car accident that they just avoided, the heart starts to palpitate. Or somebody's on a roller coaster, the excitement of the roller coaster, the heart starts to palpitate, right? So the heart function is influenced by brain function or brain malfunction. So we've got to think of the brain, where there could be infections that get in the brain and toxins that get in the brain that will change the brain's behavior, change the brain's performance of how it's going to tell the heart how to function. And remember, Sue talks about in her testimonial here that, well, you'll hear this soon at the end of the video, she had an ablation done to the AV node. She had an ablation done and the heart was still malfunctioning. So even with that medical procedure, still malfunction. Now it's fixed. So her brain had candida. Her kidneys had the epidural chemical. The kidneys are really important to understand because the kidneys help to regulate blood pressure. That is their main job, is to regulate fluid balance. They're influenced by the brain telling them how to do this, but the kidneys help to regulate fluid balance, and fluid balance regulates blood pressure. And blood pressure influences heart function and heart rate. Her lymph had a large amount of mold and mold toxins. The lymph, when it's stressed, it affects the heart function, it affects the brain function, it affects the organ function. Your lymph helps you detox and disinfect your body. When the lymph is overloaded with stress, overloaded with a burden of toxins and infections, it's hard for the lymph to control, to help its environment, to clean the environment. And when the lymph is stressed, a domino effect occurs and it will cause the heart to go under stress. Her spleen was infected with candida. The spleen is part of the cardiovascular system. What happens when the spleen is stressed? The whole entire cardiovascular system can be stressed, and in turn for her, and possibly for you as well, it can cause congestive heart failure. Her lungs were infected with candida. The lungs also influence heart function. The lungs are how we get oxygen into the blood. The lungs are directly right there, connected through blood vessels to the heart. When the lungs are stressed with infection, they totally can change the heart's performance. Her sinuses were infected. Sinuses infected. Sinuses change brain function. Sinuses can change the brain's control of the heart function. Her heart also had the Aspergillus fungus on it. I found dental anesthesia chemicals called lidocaine affecting her thyroid, Lyme disease organisms affecting the blood vessels of the entire body, Coxsackie virus affecting her heart, Candida fungus affecting the AV node, the controlling node that tells the heart how to beat. I found Candida affecting her aorta, the main blood vessel that comes out of the heart to bring blood to the body. I also found that she had various, from childhood vaccines, she had those saturated in her kidneys, and the kidneys were under a great deal of stress. So the kidneys could not perform perfectly, helping her to regulate her blood pressure, change in blood pressure, change in blood pressure to the brain or oxygen levels to the brain. The brain is going to be stressed, and the brain now changes the heart's performance. I found also that she had activated mast cells, the inflammatory MMP9 protein, also affecting her kidneys. She had mercury in the kidneys. She had the chickenpox virus affecting her kidney performance. Her liver, she had multiple, she had glyphosate weed killer, she had insecticides and pesticides affecting her liver performance. Radon, which is a terrible toxin that comes naturally from the soil, that was in the liver, stressing the liver. Her hypothalamus of the brain, which is a part of the brain, we can look at an image here of the brain where the hypothalamus is. The hypothalamus helps to regulate heart rate. It's part of what influences heart rate. The hypothalamus, there were dental anesthesia chemicals. She had activated mast cells affecting it. We'll go on to the next March protocol, which is the final exam that I did with her before she had the retest on her heart, where they found there's very little, if any, PVCs, and she has a normal ejection fraction of 55 for the first time in 14 years. I found that she had excessive mineral deposits and mold infections affecting the heart, affecting the AV node on the heart. She had the glyphosate weed killer and other insecticides and pesticides affecting the AV node. She had salicylates affecting the AV node. She had multiple yeast infections affecting the AV node. She had multiple indoor and outdoor molds and a mold toxin called ochratoxin affecting the AV node. She had a high level of mineral deposits in her kidneys, stressing the kidney function. She had as well the measles virus, yes, the measles virus, the chickenpox virus affecting the frontal lobe of her brain, which was stressing her immune system, which stressed her heart. A part of the brain that also can cause anxiety and can cause the heart rate to change is called the amygdala. Amygdala is the fear, panic, anxiety part of the brain. The amygdala, I found a bacteria called Coxiella burnetii, stressing it. Furthermore, I found formaldehyde. She was a scientist. She was in the laboratory doing work for many years. Formaldehyde stressing the hypothalamus of her brain. And I found multiple parasitic infections affecting the AV conductor, the AV node on the heart. After that protocol, she had her heart tested. The Holter monitor shows normal function. The echocardiogram, normal function. It is just truly amazing at what we've been able to do for her and help her do for herself. I will tell you the method that I use, which I go into greater detail in my book that you could find on my website, as well as in a video. I describe a little bit of a detail about this, not in depth detail, but I describe to a certain degree of the type of method I do here to help people find these different infections and toxins in different parts of the body, like what I've just shared with you. So please take the time and watch that, read my book, my free ebook, download your free copy of my ebook on my website, and watch that. The link that's on the very last page of my book, you can watch my video, 42 minutes, about my journey as a physician and doing different tests that I've done and different treatments, and also a brief insight into the method that I'm using. But I'll tell you, with my immune activation analysis that I did with her is how I found some of these infections and toxins in parts of the brain and the heart and the body and the organs. I found through certain mitochondria, low-level mitochondria, or energy performance by certain cells of the body, is how I found more of these different infections and toxins in various parts of the body. And through my emotional impact strategy, my emotional impact exam, even if somebody doesn't have depression, even if somebody doesn't have anxiety, even if somebody is walking around seems happy and seems well-centered, There could be old emotional burden, old scars emotionally that people don't realize they have. And I figured out a way, it took me years to develop this strategy. I figured out a way to be able to find in that person, in their subconscious, if they have these different emotional burdens. And she had some, and she's a delightful person and a very happy and a very jovial woman. And they have great success, monetary success, and family and friends. But there were some old emotional scars or burden that she was carrying around that I was able to figure out. And I do this for many different people. We've seen anxiety for decades disappear with my work. We've seen depression for decades disappear with my work. And we're seeing how the emotions play a role in physical performance of the body, like, for example, the heart function. And you'll see in this video testimonial, Sue was a very smart woman, and she's a scientist. She's giving credit, the majority of the credit, to helping her rid the diagnosis of her congestive heart failure to this work that she did with me and I did with her and for her. And I'm so proud of it, and I'm happy to share with you, you have a chance to help yourself rid your heart disease condition. It may be as quick as her in 3 visits and 3 treatments, I hope so. It may be even sooner than that. It might take longer. You know, the puzzle in your body is different than the puzzle of everybody else's body. You can have 2 people, same age group, same gender, same religion, and have the same diagnosis of congestive heart failure, but 2 people have different pieces of their puzzle that we have to figure out to help put them back together again. For example, let's use this analogy, the Statue of Liberty. Maybe you like the Statue of Liberty, you like building puzzles, you go to a toy store, you find 2 box sets of the same identical picture of the Statue of Liberty. You fall in love with that picture. You want to put those puzzles together. You notice the puzzle box from ABC Company has 10 pieces that you put together to make a 3-foot by 5-foot picture of the Statue of Liberty. And the XYZ Company, same picture on the puzzle box. It's also a 3-foot by 5-foot picture of the Statue of Liberty that will be complete when you complete the puzzle, putting the pieces together. But that has 1,000 pieces in the puzzle box. It's going to take less time to put 10 pieces together than a 1,000-piece puzzle. Same picture, same completed picture, same size when you're done. Understand your body is different than everybody else. Maybe you have certain root canals. Maybe you have certain infections in your jaw that we have to handle. Look into my dental page on my website, very important. I can help you get the job done. You have a higher chance of getting it done with this method than other methods out there. I've tried a lot of them. If you're ready to take this journey, you can pick up the phone and call my clinic, 954-370-3100. Or you can just email my clinic right here below. I'll put the email address here on this video. And or you can just book your appointment on my website. Take the time and invest in yourself. I will tell you, insurance companies don't recognize this work. This will be an investment in yourself. Until we get to meet you, I look forward to helping you. One day, it's better sooner than later. The time to take action is now. The time is now, because tomorrow may never come. I look forward to helping you. I'll see you soon. Hello, if you or someone you love are suffering from a congestive heart failure or another type of heart condition, you really deserve to listen to this amazing testimonial that Mrs. Sue, I can say your last name?
You may.
Halverson, what she has reported to me and reporting with me to share with you of the success that we're having after many years of certain heart condition that she'll describe to you right now, and the improvement, which she'll describe to you as well. It's pretty fascinating. So your history goes back to, right now we're in 2022, and you had a heart problem that you noticed or first recognized in by 2008, right?
Correct. I had been diagnosed with Lyme disease and a whole myriad of other things, but it manifested in congestive heart failure in December of 2008. And it's been with me ever since. I had an initial ejection fraction of 30, which is very low.
What do they consider normal?
Normal is 55 to 60.
And what we're talking about ejection fraction, that's the heart being able to pump the blood.
The blood and not have a lot of blood regurgitation into the
right. So the
chambers.
heart's able to pump the majority of the blood out to the brain and the body.
Right.
So we need to be able to pump so much out so the brain can survive and the body can survive by getting the blood supply from the heart. And the heart then has to be relaxed to allow more blood to fill into the chamber and then squeeze it back out into the brain and the body.
Correct.
So yours was not pumping enough at the time.
Not pumping enough, which also made breathing very difficult and activities very difficult. Just everyday life kind of difficult. So I have always been an active person, and I could still function, but the Energizer Bunny had to slow the pace quite a bit.
Since 2008, for the past 13 or so years,
Yep.
you've been under care of a certain group of heart doctors, cardiovascular physicians.
Yep, I've seen metabolic cardiologists, I've seen a regular cardiologist, interventional, electrophysiology, and cardiac specialist.
Was there any surgery on the heart?
I did have a cardiac ablation in 2018, and it reduced my extra heartbeats, or PVCs, about 5 or 6% from 25 to 20, but they slowly came back.
So in addition to the decreased ejection fraction, you had these PVCs,
Right.
these contractions that the heart was making, irregular contractions. So there was a certain amount, a percentage of the heartbeats that had these irregular contractions of the heart, right?
Right, about
That will-
25%.
25%. But I'm grateful that you're doing this and you're generous with your time to share with everybody what we're seeing so far. So, but your PVCs they're not healthy, they're not
No.
comfortable. You could
They're-
feel it,
Right, and they zap energy.
zap energy, and they were definitely monitored by your heart monitor.
Yes,
Right.
I've had numerous Holter monitors, 3-day, 5-day, 28-day, and they all showed the same thing.
After the ablation, only reduced at about 5 or 6% is what you just said.
Correct.
What did they offer you next?
They offered me a very toxic medication called Sotalol, and I took it. I didn't really feel I had much of a choice in taking it, and I was on that about 2.5 years, and I didn't notice any change other than it made me more tired.
Got it. And so no change in the monitor report, no change in any other cardiovascular exams that they did with EKGs or anything else?
Nothing.
And nothing in the change in the way you felt besides feeling more tired.
Right.
You got off of that med. They gave you, you were then on 2 other meds, which you're still on, but those 2 other meds, which was a diuretic.
A diuretic, and one is a
Blood pressure?
yeah. Thank
Blood
you.
pressure. So let's fast forward to now. You've had stem cell injections prior to coming here. You've had stem cells.
Two rounds of stem cells.
And did those help in any way reduce the PVCs and or increase the ejection fraction?
The first set I had in 2013 pretty much did both. It increased my ejection fraction from about 35 to 40, in the 40-45 range, but still had significant PVCs.
And so that was in 13. You did that first stem cell round, a bit of
Right.
improvement. Did you do it, the second round, did you do before the 2018 ablation or after?
After.
And the
it was January of this year.
And the 2018
2020.
ablation, I'm sorry to interrupt, the 2018 ablation was done because even though the first stem cell treatment helped to somewhat help the heart, it wasn't enough to get you feeling and functioning as normal as they wanted or you wanted to.
Correct.
So there's still risk of heart condition, congestive heart failure is still on the horizon,
Right.
basically. So the ablation brought a bit reduction into the symptoms of the heart condition, yet not really as much as the doctors hoped for. Is that a true statement, what I just made?
Yes,
Yeah.
and also the doctor, where he could find the node, but it was in a place that was dangerous for him to go in and ablate. So we left it alone.
So it was like, okay. And so the next stem cell treatment was earlier this year,
Yes.
prior to our last visit, our last exam here.
Yeah.
After the stem cells, was there another monitor that you had done prior to the exam with me last time earlier this year?
I had one in October of last year, 2021, and I had another one in 2022, May of 2022.
May of 2022.
The one in May of 2022, and after I completed your second protocol, and showed that my PVC burden had dropped from 25% to 2.17% of my heart.
That's how amazing is that?
And
wow.
Yeah, and my ejection fraction, thank you,
You're welcome,
rose to 55.
55. That is phenomenal.
Yes, it is.
It was an examination kind of specialist or someone who did the scan on you?
He's cardiac specialist, and he takes very difficult cases.
Was it the doctor who did this recent heart exam with you, or
Yes.
was it an assistant who did the exam with you?
There's a
Like
technician,
right?
and then he reads it, and then he'll come in and do more if he wants to see more.
The doctor.
Right.
Got it.
And it was also a 3D echo, so
Okay.
they got to see a lot more.
And so when the technician performed the test and they saw there was a change, that was obvious.
Oh,
with
yeah.
the ejection fraction and the PVCs reduced dramatically for the
Correct.
first time in many years.
Yep.
What did the technician make a comment, or did the technician just go like and show it to the doctor? And
They're
the doctor
not
came
allowed
in?
to comment.
They're not allowed to comment, but the doctor came in. And
Yes.
what did this physician say?
Mostly it was the look on his face. He was extremely happy, all smiles, and he was
Was it
ecstatic.
surprised? Like, wow, how is this possible? I'm just happy for you.
A little bit. And they wanted to confirm it, so they put a 5-day monitor on my chest, and
Five-day monitor confirmed everything.
everything.
2.17 and the 55%
Yep.
ejection fraction.
Yeah.
Pretty amazing.
Very
And so
amazing.
now congratulations. I'm very happy for you.
I'm very happy.
Yeah. You were at a certain point before you started care with me here for this
Right.
condition. And the medication of the high blood pressure med and the diuretic
Right.
you were on prior to coming here. But even with that med, it wasn't in any way advancing you. It wasn't reducing the PVCs, and it wasn't increasing the ejection fraction.
No,
No. So you were at a certain plateau, let's just say.
right.
And now with this work that we've done, which I'll describe, because we were able to clean up certain infections and chemicals that we found on the atrial ventricular conductor, on that SA node in the heart. So then when we find the root cause of the condition, and that's what we've been after here,
Yep.
get rid of the root cause of the diseased heart and get the body to rejuvenate itself, to put her into a whole nother pathway of having a whole nother function, a whole nother functional capacity in her life, a whole nother optimal level of heart function that other methods of surgery, ablation, and medications, and if we can say even the stem cells, they helped you some, but they didn't really bring you to this point.
I believe that they were additive, but I don't think they were the primary.
The primary. What do you
Right.
think was the primary?
You.
Thank you. Thank you. Thank you again for doing this with me to help people know you're generous with your time. Is there anything that you want to tell people that if they think it's too good to be true, or should I really, make this journey and get started? What would you say to them?
Well, I've been on both sides of medicine, and I totally understand what Dr. Herman is doing here in the clinic, and I am a firm believer in what he does, and I'm going to come back until I am so squeaky clean, he won't know what to do with me.
And so, but even still, the doctors they kind of are looking at this improvement. Almost, there had to be, even though big smile and congratulations and happy for you, there had to be a look of kind of dismay. I'm thinking, like, how is it even possible?
I don't know if it was dismay. I mean, they're very happy for
Yeah.
me, but
Well, what I mean, maybe
they're just not ready to hear
what did it?
what did it.
Yeah.
Because
So-
they don't understand.
Mhm. And now the medication is reduced in half again, the blood pressure
I'm
and the
working
diuretic?
I've reduced the diuretic, and now I'm starting to reduce the blood pressure medication with the approval of my cardiologist.
And so far in the past few weeks, things are going well
Things
still.
are going very well.
Awesome. Thank you.
You're welcome.
Appreciate it. You're welcome.
Anytime.
Yeah.